How's everybody doing today? This is Jamil Mason with Better Health, Better Nutrition. I want to talk to you today about two special minerals today. These minerals are called chromium and vanadium, and these are two minerals that can possibly help you to balance your blood sugar. Chromium activates phosphatase, glucosinase, and other enzymes, and is tightly associated with the GTF, glucose tolerance factor, a combination of chromium 3, dinicotin acid, and glutathione. The reported plasma levels of chromium in humans over the past 20 years has ranged from 0.75 to 13 nanograms per liter. Concentration of chromium in human hair is 10 times greater than in blood, making their hair analysis a much more accurate view of chromium stores and function in the human. There is 1.5 milligrams in the human body. Very little inorganic chromium is stored in the body. Once inorganic chromium is absorbed, it is almost entirely excreted in the urine. Uh, Therefore, urine chromium levels can be used to estimate dietary chromium status. Dietary sugar loads, as in colas, apple juice, grape juice, honey, candy, sugar, fructose, etc., increase the natural rate of urinary chromium loss by 300% over 12 hours. Now, I'm going to go over it once again for those who don't know what the word inorganic. Inorganic is basically means this is that it has to be in the soil. It isn't created by the plants. It isn't created by our bodies. It actually has to be in the soil. And the way they farm today, um, the minerals are just not there like they used to. So this is why I tell everybody out there you need to supplement these things. Um, but to go on a little further, the average intake of 50 to 100 micrograms of inorganic chromium from food and water supplies about 0.25 to zero point 0.5 micrograms of unstable chromium. By contrast, 25% of the chelated chromium is absorbed. The chromium RDA for humans is a range of 50 to 100 micrograms per day for adults. The concentration of chromium is higher in newborn animals and humans than it is in later life. In fact, chromium levels of unsupplemented human tissue steadily decreases throughout life. Of even more concern has been the steady decline of the average American serum chromium since 1948. And just the numbers here, um, 28 to 1,000 microliters in 1948, and the last number, the numbers they got here of more present time are less than zero point 0.1 of chromium. Fasting chromium plasma level of pregnant women is lower than of non-pregnant women, increasing the impairment of glucose tolerance in normal pregnancy is well documented and reflects a chromium deficiency, oftentimes resulting in pregnancy onset diabetes. So, in other words, when a woman gets pregnant and she gets onset diabetes, it's usually caused by not having enough chromium in. One study demonstrated abnormal glucose tolerance in 77% of clinically normal adults over the age of 70. And according to Richard Anderson, USDA, 90% of Americans are deficient in chromium. And I would actually be thinking about that if you're diabetic. I don't care if you're type 1 or type 2, if you're diabetic, that's something you want to be thinking about. Gary Evans from Bemidji State University, Minnesota, very clearly showed an increase of lifespan in laboratory animals by 33% when they supplemented with chromium. Prior to this study, uh, gerontologists led by Roy Walford felt a severe restriction of calories, sorry, was the only way to extend life past the expected average. Deficiencies of chromium in humans are characterized by a wide range of clinical diseases, as well as shortened life expectancy. The clinical diseases of chromium deficiency are aggravated by vanadium deficiency as well. And that's the next thing we're going to talk about now is also the vanadium. A minute here, that is here. Metallic vanadium is absorbed by the intestinal tract very poorly at about 0.1 to 1%. Vanadium cholates at 40% and the plant-derived colloidals at 98%. Vanadium was proven to be an essential trace mineral in 1971. Vanadium stimulates glucose, blood sugar oxidation, and transportation in fat cells and glycogen, animal starch, in other words. Synthesis in liver and muscle and synthesis in the liver and the muscle, and inhibits liver glucogenosis, the production of glucose from fat, and the absorption of glucose from the gut. Vanadium enhances the stimulating effect of insulin in DNA synthesis. Despite low serum insulin, the blood glucose levels of diabetic rats fed vanadium was the same as normal control. Vanadium appears to function like insulin by altering cell membrane function for the ion transport process. Therefore, vanadium has a very beneficial effect for humans with glucose tolerance problems, then hyperglycemia, hyperinsulinemia, and diabetes by making the cell membrane insulin receptors more sensitive to insulin. Several cultures, including American Indians, Hispanics, and Hawaiians, have a increase of diabetes when they cease to eat their ethnic foods and consume canned products or fast foods. Man, if that's one here for for Americans here, the fast food. Vanadium supplementation can have a major impact by reducing or eliminating most causes of onset diabetes. Diabetes alone costs American taxpayers a minimum of over $105 billion a year. And the numbers are actually higher now since this information came out. So my point that I want to get, and as I go a little bit further and give you a little bit more about this, the vanadium here, is that this is a mineral. I don't care if you don't have diabetes. I got over my diabetes. Was diagnosed with diabetes. I made a change in my diet, and I got over the diabetes. But now I still had sugar rushes from things like when I would eat like carrot juice or drink carrot juice. But once I started putting these minerals into my system, I stopped getting the sugar rushes. What it does is it allows the sugar now to go inside of the cell and be burned as fuel. And when it's being burned as fuel, instead of being sitting outside in the bloodstream. And so as a result, one of the benefits of it is that it can also help if you're trying to lose weight, to help you with weight loss. These are two nice minerals that you can start supplementing and adding your diet. Also, remember, I do send out samples of things. If you leave me a message, I will send you out some samples of some things that have chromium and vanadium in it. Vanadium inhibits cholesterol synthesis in animals and humans and is found by decreased plasma levels of cholesterol and reduced aortic cholesterol. Keep that in mind, it also helps with cholesterol. I also want to throw in what I always tell you about the gluten out there. Now, gluten itself is not bad, but there are bad glutens in wheat, rye, and the oats. So those are the ones that you want to stay away from, as those different type of glutens in there. Now, if you got millet, you got like corn, you got some of those other different grains out there. All I'm telling you is that use different grains out there than those three, because what they do is when they get into the body, They get into the intestines. You have alveoli. When you're born, it like like projections and they're like carpet. But as you get this gluten, if you're eating things like your cakes, your donuts, eating sandwiches, and they're using bread, what you're doing is you're just destroying the lining of your intestines. And if you're one of those people that's got one of those deficiencies like iron, vitamin B, vitamin C, what it is that those alveoli help your body to digest those things. When you destroy them, your body doesn't absorb things like they used to when you were young. But the beauty of it is that with the right nutrition and getting off of those things, the alveoli can come back. Vanadium initiates an increase in the contractile force of the heart muscle known as inotropic effect. Vanadium is known has known anti-carcinogenic properties. Induction of the mouse mammary tumor growth was blocked by feeding 25 micrograms of vanadium per gram of diet. The vanadium supplement reduced tumor incidence. Average tumor count per animal and prolonged median cancer free time without inhibiting overall growth or health of the animals. Sure beats chemotherapy and radiation. Not trying to tell you not to take chemotherapy and radiation. I always tell you with anything, the information that I give you, if you're on something, have your doctor take you off. Don't take yourself off of anything. If you're going to try these new supplements and which will, help you with your health and everything, make sure that one that your doctor knows about these things, and number two, when you start to see the improvements, you don't take yourself off, but the doctors take you off. I don't want to see any of you out there get sick from taking yourself off of something prematurely. None of the diseases associated with vanadium deficiency include slow growth, increased infant mortality, infertility, elevated cholesterol, elevated triglycerides, hyperglycemia, hyperinsulinemia, diabetes, and cardiovascular disease. I like to got a nice little story somebody told me yesterday. Had this couple. A friend of mine introduced me to the couple. He had told me that the husband had basically had phase three of liver. And they asked me about some things that they could take, and I put them on this actually the same stuff that I give out samples of. Now he couldn't take it like I suggested him that he do because he was too sick to do that. But he started taking as much as he can. Now, one of the other things, he had heart problems. He also had diabetes and everything. And the wife called me, and she talked to me yesterday. And what she was telling me is that he didn't have to take anything for diabetes anymore. And I understand he's only taking a little glass of it in the morning, a little glass at night. I want him to take 16 ounces of it. He's not taking close to that. And I had suggested to her at the time now to add one, around lunchtime, as he increased. But his heartbeat is back to normal and everything, and the liver function is starting to return. They took him off of hospice care. And at the same time, they're talking about putting him on chemotherapy. Now, once again, it's up to a person what they want to do. If they want to go through chemotherapy, I don't tell you not to listen. I'm not telling you not to listen to the doctors. I'm trying to tell you, don't let the doctor be the only thing that you do. I had health problems years ago, and I realized a long time ago, if I only listened to the doctors and the doctors alone, my health was not going to get any better. I listened to the doctors and I did some things on my own and I researched some things on my own and I used my own self as a guinea pig and that's how my health improved. And there was a lot of people that told me over the years, there are times that I thought that was probably going to be the last time I saw you because you were so sick. That's why I got into the nutrition thing because of my own health. I was trying to save my own life. Now today, I mean, that's the thing that I do today is because, I'm always still trying to find new things to help with my health. I know this new thing that I'm trying right now, I'm gonna be trying in the next few days is a thing called the X39. Now this is different in the sense is that this is something you're gonna take internally into your mouth. This is something you put on your skin. It's a patch. And it's got a lot of different things. It helps with pain. It helps with a whole bunch of different things. But I will be talking to you about these things. But this is Jamil Mason signing off with better health, better nutrition, giving you some more information, some nuggets out there to help you to get better health out there. I love you all. I'd like to see you all get better health. If you got questions, leave messages. If you want free samples, once again, leave messages, and I'll get back to you soon. You have a great day.